Mr. John Doe, 97-year-old male. He's a full code status. He's got a severe latex allergy. 3 days ago, an ambulance brought him into our ER department because he was found on the floor of his home with his 95-year-old brother, who he lives with. He was noted to have 5 pressure injuries, 2 in his upper shoulder, 1 behind both of his elbows, and then 1 on his buttocks. He was extremely disoriented and confused, only ANO times 1. Once they brought him into the ER, they were able to give him fluids. He became stable, ANO times 3. Patient is excessively hard of hearing. The best form of communication for him is to write something down and he can answer. He's got a history of atrial fibrillation, so we have him on the telemonitor. Last night I was noticing that he was having multiple PVCs and PACs. I called and notified the doctor. The doctor said to just wait and continue to monitor. If anything increases or changes significantly, to call and notify him again. His 5 dressing changes were done yesterday. They're documented on Epic, and they are not due again until tomorrow. So just keep an eye on them if he complains of any irritation, but so far so good. Patient was stable up until last night. He spiked a fever of 102.3 Fahrenheit after complaining of chills and aches. And upon a quick assessment, I noted crackles in both the bases of his lungs. I gave him Tylenol to help reduce the fever. And I called the doctor. The doctor has ordered a chest x-ray for sometime this morning. I have yet to get a time because he's suspecting pneumonia. So for now, all we gotta do is we gotta monitor his vitals, make sure and keep an eye on that temperature. It came down a little bit, about 99. The last Tylenol I gave it was at 4 o'clock, so it's PRN Q4 hours with a temperature of above 100 degrees Fahrenheit. So he's due again in about an hour at 8. You need to call x-ray and figure out what time the patient needs to be going down. And for now, the patient is a severe fall risk and an aspiration risk. So we have the wristband posted, the door sign posted. His bed is locked low with the bed alarm on, and every time I go in there, I remind him of the call light. So we got to keep an eye on him. Okay, and then for aspiration risks, keeping the head of bed a little bit up, yeah? And we're gonna make sure that his diet is strict to nectar and minced. Other than that, he's a very pleasant man. It's hard to talk to him. If you're gonna try to speak to him to get him to hear you, you gotta speak in a really low tone. And even that, it's difficult. I do recommend using a writing tool or finding a whiteboard. Is there anything else I can do for you?